Hi, this is Andy Schumann from Gizmos with another tabletop tech review. I'm a pediatrician, and in the course of the day I look at dozens of ears in order to visualize the tympanic membrane and identify those children with fluid behind the eardrums or ear infections. To accomplish this, we sometimes have to remove cerumen in children and young adults. Over the course of time, we have developed a variety of ways to accomplish this. So I thought I would show you techniques that I prefer for removing cerumen from a semi-cooperative child. Obviously, we don't want to do any harm. We don't want to perforate an eardrum. We want to do this as quickly and as comfortably as possible. The first thing to consider doing is to soften the wax. Now, this can be done at home if necessary. Sometimes it takes several days to soften earwax. There are lots of medicines that are available over the counter that will soften earwax. In my experience, if you use some Colace liquid or even some hydrogen peroxide and infiltrate a cotton ball with this, or soak a cotton ball in this liquid and put it in the ear that needs to have the earwax softened. Sometimes, if it's just one ear, you can put a cc or so of fluid containing either hydrogen peroxide or Colace, and this is something that will soften the earwax. Commercial products such as Cerumen X will work equally as well. The softening agent needs to be in contact with the wax for several minutes before you should attempt irrigation. Irrigation is probably the easiest way to remove wax. Curettes can be somewhat intimidating and hard to use. These come as plastic and metal. I never use a fixed, hard, non-flexible metal curette in the ears. This is something called an easy ear, which is flexible. It's got a spring. So when used cautiously and carefully, you can use it to effectively remove soft rumen when you can visualize the cerumen within the ear canal. Perhaps the best way to remove softened wax is by using either a syringe or a wash bottle. These are commercially available. This is the professional version. It's called the Elephant Ear Washer. It's not very expensive. It comes with this tube which is attached to a flexible attachment. This is carefully inserted into the ear canal past the occlusion. So when you spray the bottle, which is filled with warm water with a little bit of peroxide, you can push the earwax out of the canal as opposed to towards the eardrum. You can accomplish the same thing with a large syringe, 20 mLs or larger, with its same attachment, pushing it past the occlusive earwax and irrigating the wax out of the ear canal. Usually the child is sitting with a container like this under the ears. We use chucks to make sure the child doesn't get wet, and the child or the parent holds this. And usually in a matter of seconds or minutes we're able to clean the ear so we can visualize the eardrum. Ear irrigation should never be attempted with a child or in a child with known tubes with drainage. These attachments are very inexpensive. They're called the Rhino Ear Washer and Elephant Ear Washer tips. They cost less than $1 a piece. Prices are reduced when you buy a lot of them. These are inexpensive enough that you can use them and throw them away. Before these were available, pediatricians would use feeding tubes, butterfly tubing, flexible IV catheters as an alternative. The idea is that in the ideal situation you want to be able to get the tip of the tubing beyond the occlusion so you can push the wax out of the ear canal. In my own experience, using alternative methods that merely send a blast of water into the ear canal often don't accomplish the task, and in many situations will even push the earwax further into the ear canal. So in the future I will show other devices that may have some utility in earwax removal. One needs to be caring and considerate. One needs to use lukewarm water as opposed to hot water, or cool water when you irrigate and flush the ears, because this, if you don't do this, you can cause some dizziness or discomfort for the patient. This is Andy Schumann from Med Gizmos. Have a nice day.